message of the president's trip to Arizona?
We have two messages. One is that he's going to the Honeywell factory. Honeywell made a commitment and then delivered on that commitment to help produce high-quality N95 respirator masks, and they've been a wonderful partner, one of many in the private sector, really stepped up and stepped in to help us surge the supplies, Joe, that we needed to mitigate and in fact treat the COVID-19 patients and mitigate their harm and their hurt. Also, he'll be doing a roundtable with the Native American community on our missing and murdered Indigenous women proclamation executive order that he's going to sign. Also, we've been on top of that here since the beginning. We had an event around Thanksgiving time, late November, in the Oval Office with a number of tribal leaders, redoubling our commitment and adding money to allow us to trace and investigate and find these missing and murdered women. I think they've been undercounted for a very long time, and every one of them counts to us. They're not nameless and faceless and gone. And also the president will be talking about the $8 billion commitment we've made through the CARES Act and other resources to the tribal nations, which, along with the African American population, the elderly population, in some areas the Hispanic and Asian American population, are one of those vulnerable populations that's been particularly hard hit.
Two things. Everybody's going to have to get tested. Who's going to be meeting with the president?
Yes, we do that here too.
Also, it's a battleground state. Can you sort of address the political issues, if there are any?
Well, those are two very different things. Everyone will be tested. We're tested here routinely as well. I know you get your temperatures checked when you walk in. Nice mask. And battleground state, sure. I know that in 2016 we kept hearing Hillary Clinton was going to turn, I think it was Georgia, Texas, and Arizona blue. Probably spent more time in a couple of the states than she did in Michigan and Wisconsin. But the president looks at the entire country as a battleground. You know that. He's the president of the entire country. That's why he gets high praise and has been collaborating great with governors like Gavin Newsom of California and Andrew Cuomo of New York and even Phil Murphy, or especially Phil Murphy of New Jersey. So I know Senator McSally is joining the president on the trip as well. She'll be on Air Force One today with the president, and she'll be there as well. She's in cycle this time, but I'll refer those questions to her campaign.
The vice president said it was a mistake, that he should have worn a mask when he was at the Mayo Clinic a couple of days ago last week. The president will be going. He's obviously the most prominent public person in this country. Would there be value in him wearing a mask? Has a decision been made about whether that would be the right decision given the social distancing?
As the president would say, let's see what happens. I will say something also that the vice president said last week, and that the president says, and that we all know, which is that they're also tested routinely. We all are. But I'll let the president make that decision.
And then just to conclude, I know these projections that came out of Johns Hopkins yesterday, obviously they said they were preliminary, they shouldn't be viewed as forecasts. They said, however, they do demonstrate that premature rolling back of social distancing guidelines can lead to higher deaths and illnesses. We know that. That's not breaking news to folks right now. What is the challenge for the White House to try to balance the desire to have the economy do well, and the fact of the matter is that as we do this, deaths will go up. This is just what it's going to look like, isn't it?
It is a balance, and thank you for just admitting the facts. That is true, and I think the governors themselves are grappling with the same set of facts, as we respect the fact that they have the final pen on whether or not to reopen the entire state, this part of the state. If you have a couple hard-hit counties and people live hundreds of miles away from there in your state, perhaps you can differentiate. I've seen actual governors, I've seen state plans that have done exactly that, different industries opening up before others, Pete. So it is a balance. One thing you said about pulling back the social distancing guidelines, I would just remind everyone that the CDC guidelines are in place. People should look at them. It turns out we Americans can follow instructions, and we were part of the solution here. Every death is a loss, and we mourn every single death, those that have already occurred, those that will be lost today, and those that will be lost in the future. That should not just be glossed over or put as a footnote. That is the story of this pandemic, or those precious lives lost. And to continue to mitigate that number, we should absolutely follow the guidelines when possible. And those guidelines do keep telling us to stand apart as we are now. Some of you are wearing masks. I'm sure you've washed your hands a few times already today, and will continue to, Pete. And also to just to be sensible and smart about it. I think we call it the smart, sensible, gradual reopening. But we're listening to the governors, and we told all of the governors and their health commissioners, if you want us to look at your plans, we're happy to do that. And our medical team is doing that, our economists are doing it, others of us are doing that. I think you're going to start to see some of the sports leagues have a more concrete plan with some specific dates involved as well. Maybe fans, maybe not fans. You'll start to see some other areas. And one thing I'd like to mention, doesn't get enough attention, I actually said this to the president yesterday, our critical infrastructure workers never stopped working. And so in some of these states, you did not turn off 100% of the economy, because our brave men and women in healthcare, first responders, also wastewater management, energy, telecom in some places, sanitation, food handling, so many of them never stopped working because they were critical infrastructure. And we're also trying to look at those best practices to see where, so for example, you've had obviously heartbreaking outbreaks in different nursing homes, in prisons. You haven't had as many in, say, grocery stores, where a lot of the public has come in, but they've been able to have protocols. We're looking at best practices as well to try to say, state by state, here are some things that are working. And it's been a really good collaboration. I think those conversations will just continue, and people are going to have to make their own decisions too. Some people are afraid to go back to work, and some people are itching to go back to work and pay those May bills.
That 134,000. Oh, go ahead.
So the president said he was going to go to Ohio last week. Do you have any updates on that trip?
I do, but I'm not sure that we've said that publicly yet. So I'll just I'll let the press shop let everybody know.
So that 134,000 death toll estimate probably seems like a lot to some people, especially when we started out at 67, 68. What do you say to those people who are, sitting out there wondering how many deaths is too many?
Well, one was too many. I think the president was asked that one time in the briefing room about 5 or 6 weeks ago. He was asked by a press colleague, not your network, but a press colleague, Joe, how many deaths would be acceptable to you? And he said 0. And I have to keep reiterating that. 1 is too many. I do want to go back to something Pete admitted and just repeat it since you asked the question again about that model. Even Johns Hopkins and the gentleman who you're probably all familiar with said that wasn't ready. And I guess he hadn't approved it or he hadn't evaluated. I'll let his...
You're referring to the University of Washington
right.
model.
Oh, you're doing the university, not the... I gotcha. University of Washington model. And so even there, I think their projections have gone back and forth. And I believe that we all know there will continue to be cases, there will continue new infections, there will continue to be deaths, and that we're never truly free until we get a vaccine. Everybody knows that. That's why I stand by my previous comments about safe, gradual, and sensible reopenings, and also people have to feel comfortable as well and continue to be safe and sensible. I think the most important thing for us to discuss in this building is how we can continue to mitigate the loss and the damage and continue to allow Americans to be part of that solution. So we now have an excess of ventilators. We're sending them to other countries that are asking for them. We are getting testing on board. We're ramping up testing, sentinel surveillance, serology testing, convalescent blood plasma testing, obviously diagnostic testing, antibody testing. All of that will continue to increase. The swab deployment has really been remarkable and will continue to do that. We've got the National Guard sanitizing our nursing homes. We have the CDC professionals on the ground in the states saying, I want to help you with the next phases of testing. That will all continue. That's not going to stop. They're looking at a phase 4 package, I guess, some people. And so all of that will continue. And we've got to look at that as well. I mean, I think, 1 death was too many. And none of us should shrug our shoulders and just forget that it's just the nature of the game. The president said last week, I think it was last Thursday at our seniors event, in the Older Americans event in the East Room, he answered a lot of press questions. And he said he's just looking at the death and he sees death. And that's his major focus. That's why he's mad at China. He was saying that in answer to the question. Could you have been more transparent? How did this happen? Why didn't you tell us more? We paid $830-some million over 2 years to the World Health Organization. Biggest giver by far. China gave 10% of what the U.S. gave. I think the American taxpayers, at the very least, Joe, those who have suffered and those who feel like they're completely uninfected and unaffected, everybody should be upset that a minor return on investment of our money to the WHO should have been honesty and transparency about this global pandemic. Yes, it can spread from human to human. Yes, it was a global pandemic long before they said so. So we'll be looking into all of that and more.
Do you have an update on Venezuela, the Americans?
I was just asked about that. I'm going to let the National Security Advisor, the President, answer that. They'll be on the trip together today. I'll just remind you that we say Maduro is an illegitimate leader of Venezuela. We think he's a thug and a murderer. And I just don't want to get into the specifics there. If the president himself hasn't weighed in, he and Ambassador O'Brien will be on the trip. They'll be walking out together to Marine One in about an hour and a half.
One thing I haven't heard anybody address is whether the president is traveling to Arizona to sort of implicitly suggest to them that they need to open up quicker.
Well, no, we've dealt with Governor Ducey there and his health team quite a bit, and they've done a remarkable job also. But again, that's up to the governors, each governor, including in Arizona, Governor Ducey. So I've heard Governor Ducey address this actually in one of the governor calls in the last couple of weeks. And we'll see how they're doing, how they feel how they're gradually reopening. But at the same time, you have a president doing what only a president can do, which is whether it's the Domestic Production Act or teaming up with companies like Honeywell to surge these supplies that we needed at the time, Joe, and still need, or going there to say to the tribal lands, we're on top of this missing, murdered Indigenous woman issue, like no other administration's ever been, plus we're giving you more money than any administration has ever done in such a short period of time.
Cantwell sent a letter up just a couple days ago saying that money had not yet been dispersed. Do you know anything about that?
I don't know about the disbursement. I don't know if that goes to Treasury or the Congress. I have to look at that. But I certainly know it was approved by Congress and signed into law by the president. So hopefully it'll be coming. All right, have a great day, everyone.
Thanks.
Take care. Bye-bye.